Men over 60 use baking soda. This way for stronger blood flow and vitality. Before you reach for the little blue pill, there may be something in your kitchen you need to know about first. You are not broken. And no, this is not just aging, it's a blood flow problem. The ratio and timing make all the difference. And most people get both wrong. Welcome back. And with over 15 years of clinical experience specializing in men's health, I want to talk about a private moment that many men over 60 experience, but very few talk about. It's that moment when you look in the mirror after an intimate encounter that didn't go as planned, and the self-doubt creeps in. You start asking the hard questions. But as I just mentioned, we need to stop blaming your age and start fixing the plumbing. That simple white box of baking soda that costs less than $2 can actually be a game changer for your vitality. Before we dive into the exact science and the precise protocol to use it safely, do me a quick favor. It truly helps this message reach other men who need to hear it. And let me know what state or country you're watching from in the comments below. So how can something so simple possibly work? It comes down to understanding the lining of your blood vessels, a crucial layer called the endothelium. Think of it as the smart surface inside your body's plumbing. This layer decides when to open up and let the blood rush in. But as we get older, due to diet and stress, our bodies can become overly acidic. This acidic state causes your blood vessels to constrict and clamp down. It traps the single most important molecule for an erection, nitric oxide. This is where baking soda or sodium bicarbonate comes in. It acts as a powerful neutralizing agent. When taken correctly, it can help gently buffer the acidity in your system, allowing your blood vessels to relax, open up, and finally release that trapped nitric oxide. But this begs the question, why is my body becoming acidic in the first place? It's not random. It's often the result of 3 silent habits that many of us do every single day. First is your nightly sugar habit. That bowl of ice cream or those cookies after dinner are a primary source of acid production in the body. Second is chronic stress. When you're constantly worried or anxious, your body is flooded with the stress hormone cortisol, which is highly acid-forming. And third is a lack of alkalizing minerals. These come from dark leafy green vegetables. If your plate is mostly beige and brown, you're missing the minerals that naturally fight acidity. Remember, baking soda is a powerful tool to help fix the problem, but you also have to stop pouring fuel on the fire. Let me tell you about a patient of mine. He's 61, came into my office defeated, ready to accept the side effects of prescription medication simply because his blood flow was so poor. I asked him for one thing. Before filling that prescription, try a specific protocol for just 3 weeks. He was skeptical, but he agreed. Not even 3 weeks later, he called my office. He told me that for the first time in years, morning wood had returned. Now, that's not just a crude joke. It's a critical biological sign that your vascular system is beginning to heal and repair itself while you sleep. So, how do you know if your own blood vessels might be clamped shut by this acidic state before you even try the protocol? Let's do a quick 3-second at-home check right now. I want you to ask yourself if you've experienced any of these 3 signs. Sign number 1, cold hands and feet, especially when you're trying to fall asleep. This is a classic indicator that blood isn't circulating properly to your smallest capillaries. Sign number 2, frequent muscle cramps or Charlie horses at night. This can be a sign that acidic buildup is preventing proper blood flow and oxygen delivery to your muscles. Sign number 3, getting winded easily from simple activities like climbing a single flight of stairs. If you find yourself out of breath when you shouldn't be, it's a sign your vascular system is struggling. If you answered yes to even one of those, then the 1/4 teaspoon of baking soda we're about to discuss is absolutely meant for you. All right, this is the part where you might want to take notes because the details are everything. First, the ingredient. You must use food-grade baking soda, the kind you buy in the baking aisle. Do not use the kind meant for cleaning, as it can have contaminants. Second, the golden ratio. We are talking about exactly 1/4 of a teaspoon. Measure it out precisely, no more. This is not a case where more is better. You mix this into a large glass of water, at least 8 Oz. And third, and this is the most important rule, the timing. You must drink this on an empty stomach. The ideal time is about 2 hours after your last meal, right before you go to bed. Why? If you drink this with food in your stomach, the baking soda will neutralize your stomach acid, and you will completely ruin your digestion. We want it absorbed into the system, not fighting your dinner. Now, for those of you who want to take this to the next level, here is the 10x booster. Baking soda opens up the pipes on a chemical level. But if your nervous system is still stressed out, your brain will override the signal and pull blood away from your pelvic region as part of the fight or flight survival response. To get 10 times the benefit, you must do one more step right after you drink the baking soda water. You're going to perform 3 minutes of diaphragmatic breathing. It's simple. Sit quietly. Breathe in through your nose for a count of 4, letting your belly expand like a balloon. Then breathe out slowly through your mouth for a count of 6. This simple act tells your brain you are safe, switching you out of survival mode and allowing blood to flow freely where you need it most. The combination of chemistry from the baking soda and neurology from the breathing. It is the ultimate 1-2 punch for blood flow. Now, I need to be crystal clear. This protocol is powerful, but it is not for everyone. This is an urgent medical warning. Baking soda is a form of sodium salt. Therefore, if you have been diagnosed with high blood pressure, congestive heart failure, or kidney disease, or if you are on a strict low-sodium diet for any reason, you must not try this without speaking to your personal doctor first. Your safety is my #1 priority. Following medical advice responsibly is what builds true health. So think of baking soda as the tool that helps clear the pipes. But for truly powerful rushing blood flow, you also need a powerful engine. Now that your blood vessels are ready to open up, you need to give them the fuel that triggers the most powerful nitric oxide release. So, discover the correct way to combine olive oil and vinegar, the protocol that has helped thousands of men restore their vitality naturally. And I'll see you in that next.